Hello, and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are talking to our careers department. Here with me, I've got Bobbie Pruett, the regional HR manager, and Marquita Holloway, who is a recruiter here at West Tennessee Healthcare. Welcome, guys.
Hello.
Hello.
Thank you guys so much for coming in.
Thank you for having us.
Thank you. Yes, so both of you, neither one of you have been on the podcast before, so I want our listeners to get to know you guys a little bit better. If you want to, just kind of tell me a little bit about yourself, how you got this job with West Tennessee Healthcare. Bobbie, if you want to go first.
Yeah, thank you. I started with Tenova in 2016. So whenever West Tennessee Healthcare purchased us in 2018 is how I got to be with West Tennessee Healthcare. So I've got about 10 years of human resources experience in total.
Great. And Marquita, what about you?
So I'm coming up on 1 year with West Tennessee Healthcare, so yay me.
Right. So you're a recruiter.
Right.
So what does that involve? What does a recruiter do?
So we basically try to find the best candidates, quality candidates,
right,
to fulfill our needs here at West Tennessee Healthcare to take care of our patients.
Great. So we haven't done a podcast really before on how HR and our careers work here at West Tennessee Healthcare, so we wanted to kind of give people an inside scoop on that. So I kind of want to start with Bobbie. We want to kind of talk about what are the general functions of the Human Resources Department in our hospital system.
Yeah, absolutely. So a huge thing is the recruiting, of course. We do a lot of recruiting. We hire a lot of employees. We're a very large system, so we have a lot of recruiters with us. We also do compensation and benefits, so making sure that our rates are up to date, that they're great in the market. We kind of go over, and our benefits, of course, we have those. We are always making sure that we have good benefits for our employees, that they are cost efficient for our employees, and constantly looking into those. What can we change? What can we do better? What can we add? What are other organizations doing that work? Also, employee relations. So we always have opportunities for improvement with employees. So HR handles those, make sure that we are compliant with everything that we do. And then the compliance is a big portion of it. Of course, we keep track of all licensure. We have a lot of licensed employees, so that's a large part of what we do as well, to make sure that all of our employees are good to work and have everything that they need to do their job well.
And I know you guys do a lot of events within the system. I know just the day that we're filming this, we just had an event in the Jackson Madison General Hospital cafeteria department for employees looking to
further their career.
Yeah, so we had a career expo to help people further their career. So, you may come into the system and you may start with a job, but that doesn't necessarily mean that's where you have to stay.
Absolutely. That's one of the great things about West Tennessee Healthcare is we have so many promotional opportunities. You can come in our EVS or dietary department. We have tuition reimbursement. We can help you go to school.
That's a great thing.
Go to nursing school, go to business school. There's so many opportunities whenever you become an employee with us.
Right. And how many people, do you have the numbers of how many people are employed within the West Tennessee Healthcare system?
7,000.
It's like it's 7,000. We're one of the largest, or the largest.
We are the
largest employer of West Tennessee. Yes. So that also involves, we're filming this podcast in Jackson, Tennessee, where we've got the Jackson Madison County General Hospital, but we also have regional hospitals, all over West Tennessee. And I wanted to kind of ask you, why are our regional hospitals so important?
Yeah, so they're extremely important because those are mostly critical access hospitals.
Right.
And what that means is if there's an accident in one of the outerlying areas, think Martin or Dyersburg, where you're 45 minutes to an hour to an hour and a half away from Jackson Madison County, you can get to those hospitals. They can get you the care that you need there. And then if you need further care, they can get you to Jackson Madison County quicker than what you would be able to get there. So you can come in, get taken care of, hopefully not have to be, but if you do need a higher level of care, they can get you to Jackson Madison County safely as well as being taken care of on your way.
Great, right. And I know Camden has been featured with the Certified Heart Care Center.
Yeah.
So that's great that these hospitals they're going above and beyond. They're accrediting themselves with national affiliates for what they're able and capable of doing. Now, how many people do we employ in those regional hospitals?
Roughly between 900 and 1,000. So it's a pretty large amount. The hospitals are smaller, but we have a lot of really great employees there.
Right. Now, so what are some of the challenges that the regional HR business partners might face?
So recruiting is definitely going to be a challenge for those because they are in smaller cities, smaller towns. It's hard to recruit for those places. So when we do have openings, when we do have turnover, it is difficult sometimes to fill those vacancies because people want to come to the bigger hospitals. They want to come where all the action is. Right. But what I like to tell people is there's plenty of action at those smaller hospitals because those patients are coming through there first. So they're kind of the first line. So a lot of times they'll come and then get taken out. But a big thing is recruiting for that. One of the flip sides, which is really great for our employees, it is that small feel. You have that family, you have your team, and it's just a really great opportunity to really grow, learn your skills, and just get to take care of a lot of really, really good people.
Right. And I imagine living in some of those smaller cities, it's easier to not have to drive so far for work. Like it's right in your backyard.
Yep. It takes me 6 minutes to get to work. I live in Dyersburg, and that's where I'm at most of the time. Yes. So, yeah.
That's great. Okay, so Marquita, you're up now. So as far as the recruitment department, tell me a little bit about our talent acquisition team and what our recruiters and our onboarding specialists do.
So with our recruiters, of course, we are looking for those quality candidates to fill those vacant positions that we have within West Tennessee Healthcare.
Right.
And the onboarding specialists assist the recruiters. Once we get them in, offers are made and they've accepted, they help us collect that valuable information and documentation, licensure information so that they can effectively move into those roles.
Right.
And they also keep us in line and let us know when things are there and aren't there. So we make a great team.
Right. It's a team effort.
It's a team effort.
So, when people think about hospitals, when they think about healthcare jobs, they're probably really pretty much thinking of the people who provide direct patient care, like doctors, nurses, radiology techs, respiratory therapists. But hey, you know what? A hospital system, there's a lot of people behind the scenes, not just patient facing. What are some of the other positions that recruiters are looking to hire here at West Tennessee Healthcare? So
yes, we have hostesses. Of course, they take those orders for the patients and take those trays to the room and provide that direct facing customer service experience. We have the dish room where they're sanitizing and cleaning those products once they come back. We have patient access that, of course, register the patients and collect the co-pays, environmental techs that are cleaning and sanitizing in the hospital as needed, medical coders that are assisting with billing, and of course we have others like IT.
Right. So, IT, and see, I'm in communications, so there's a communications department, and we're the ones getting the information out to the general public. So there's lots of jobs within the healthcare system. If healthcare patient-facing jobs is not what you're thinking about. So what would be some of the challenges that our recruiters are facing?
Wading through those thousands of candidates that apply
I can imagine.
weekly.
It's probably a lot.
And try to find the best quality candidates for those positions. And then, of course, staying competitive with other areas that are also trying to do the same thing.
Right. So if someone's wanting to apply to work at West Tennessee Healthcare, what can they expect after they submit their application? Kind of what's the process with applying?
So we try to reach out to these candidates within 24 to 48 hours of their application. Of course, that will depend on how many applicants we do have, but they can definitely apply on the WTH.org careers page, and we'll try to get back to them as soon as possible.
Great, yes. And so if they wanted to visit that page, it would be WTH.org/careers. I think you can get
/careers.
/careers, and you can get right to that page and see the list of the jobs that are available. So I'm going to open it up to both of you guys now. We've got some more questions. I know recently we've been posting on our social media and different places that we have switched to a new platform here. We've got Workday now. So the application process, if people have looked before, recently, just back in September, this has all changed. We're in Workday now. So what is Workday, and how has it changed the application process for candidates?
So Workday is a platform that we are now using that has combined many of our systems that we were using. One, of course, is the recruiting platform. It's also the hiring platform. So our HR software that is all housed, kind of our HR files, employee files, as well as our education. So we have continuing education that we do, formerly TEDS. We've now put that into Workday as well. So it's just one simple platform to use where you can go for all of your things. To check your pay stubs, you can change your direct deposit, your address, your name. It's a really great app that you can use.
Yeah,
also,
so you can use it on your phone.
You can absolutely pull it up on your phone, check your pay stubs. You don't have to be at work in order to log into the system to make changes.
Right, to see what you've got going. And I know with current employees, this has been a big deal, that it's not a bunch of different systems. It's all kind of rolled into one to make it much more simple and easy.
That is correct.
So, Marquita, I guess based on your experience in recruiting, what would be some tips maybe that you have for job seekers?
Well, of course, be patient.
Right.
But also always attach a resume.
Yes.
I've been receiving a lot of applications with no resume. You would be surprised. It's very important to attach that resume and enter your work history fully.
Right.
It may seem like double working because you're already attaching your resume, but that also shows recruiters that you follow instructions and you're willing to take those necessary steps to get the position.
Great.
Absolutely.
So in terms of people who would make a good fit for this team, what are some qualities that you guys have noticed that I guess would make somebody a successful employee here at West Tennessee?
Well, for me, it goes back to the company values.
All right.
If you can embody those company values, then of course it would not only help you here at West Tennessee Healthcare, but it can also help you in your personal life. And of course, those company values are continuous improvement, accountability, respect, excellence, and stewardship.
Right. And I mean, I know the company's very big on listening to people, wanting to get the feedback and make the necessary changes to make it the best and safest place to work.
Always improving.
Right. And so what, I know we kind of talked about this a little earlier, Bobbie, but do you have any more, if there's any more benefits of working at West Tennessee Healthcare?
Yeah, so one of the great things I think about healthcare is flexible schedules. So we have tons of statuses that you can go into. If you maybe want to work once a week or go to school and you need to work on the weekends, we have tons of different schedules that can really help people to be able to work and go to school or have that work-life balance that they need. Another one, of course, is competitive pay. So again, our compensation department does a great job of making sure we're in the market, making sure that we're competitive with that. And then something new that we've came out with is our Professional Development Academy.
Okay, great.
And that is for employees who are really looking to further their career. Maybe they, came in and they're in patient access, but they really want to be a nurse. Well, we're partnering with them, mentoring them, helping them get that route in which they can go, whether that's going back to school or just getting on a leadership track. Maybe they're a nurse already and they want to be a manager. Well, we're going to partner with them to ensure that they have that skill set so that they will stay with West Tennessee Healthcare and continue to further their career with us. Yeah,
right. I didn't even think about that in terms of employee development, professional development, you don't even have to start out, you could start out in, like you said, patient relations and then decide, hey, you know what, this nursing seems like something I might be interested in, just, I guess, if you're around that, and you can just switch over to that.
Yeah, absolutely. And we have, observation where you can go on your time off if you want to go and observe in a department and say, I think I might like this.
But it gives you a kind of an inside look before you make the decision to swap. Right.
Absolutely.
So where can candidates get more information? I know we talked about the careers page. Are there any other ways that they can get more information about the job opportunities here at West Tennessee Healthcare?
Well, definitely our West Tennessee Healthcare careers page on Facebook. Our marketer for HR, she does a really great job of posting positions on that, keeping it really up to date. Things like the Career Expo today. If we have job fairs going on, anything like that, it'll be posted to that page as well.
Yes, all of those. And I will be putting these into the show notes. We'll link to the West Tennessee Healthcare careers page. We've also, we'll link to we have a West Tennessee Healthcare Careers Facebook page and Instagram page. And we also have West Tennessee Healthcare Careers LinkedIn as well as that. So yeah, they do a really great job of highlighting jobs that people have, like highlighting different employees, sharing what jobs are needed and kind of what goes on in those jobs.
Yes.
Well, thank you both so much for coming on. This was great.
Welcome.
This was really great and very informative about kind of what goes on in the hiring process for this company.
Absolutely.
Yes.
Thank you so much for having us.
Thank you guys so much for coming on. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.